Risk Assessment Teach One Assignment by Brittni Beverly-Adams, HAP 725. This presentation was prepared as part of HAP 725 course on risk assessment taught by Dr. Farrokh Alemi at George Mason University, Department of Health Administration. Brittni Beverly-Adams is a student in the Health Informatics field, graduating in 2020. I will be explaining question 2 from week 3 assignment. We are asked to calculate all four ICD-9 likelihood ratios shown in the table above. The goal is to complete the table shown above. Likelihood ratio. The likelihood ratio in context to this problem is the likelihood that a certain event would be expected in a patient with a targeted disease compared to the likelihood that the same event would be expected in a patient without the target disease. The target diseases are myocardial infarction, diabetes, congestive heart failure, and alcohol abuse. Before calculating the likelihood ratio, we have to binaries our data. This SQL statement binarizes the occurrence of disease as 1 and the absence of the disease as 0. We created a table called mm_index with the results. Next, we calculated the weighted average length of stay for each diagnosis. This SQL statement is shown above. We calculated the weighted average because the number of patients varies for each disease. Next step shows calculations of the likelihood ratio for myocardial infarction. The first paragraph shows how to assign patients with an average length of stay above weighted average as 1 and below weighted average as 0. The variables used are MI and long stay, MI and short stay, not MI and long stay, and not MI and short stay. The bottom paragraph shows how to calculate the likelihood ratio using the declared variables average length 1, long, and short. This formula represents the prevalence of patients within a long stay divided by the prevalence of patients myocardial infarction with a short stay. The results for likelihood ratio calculated for MI is listed above. The next few codes are exactly the same, except we are changing the variable names to represent the ICD-9s we are finding the likelihood ratio for. For example, we change MI and long to CHF and long, and so we should do that for all the other variables. So it now should say CHF and long, CHF and short, not CHF and long, and not CHF and short. The results for the likelihood ratio calculated for CHF, also known as congestive heart failure, is listed above. And so we do the same thing for calculating the likelihood ratio for diabetes. And the results for the likelihood ratio of diabetes is listed above. And so we would do the same thing for calculating the likelihood ratio of alcohol abuse. And the results for the likelihood ratio calculated for alcohol abuse is listed above. When calculating the likelihood ratios, you can run all four ICD-9 codes in the same query. The results of all the ICD-9 codes ran on the same query is listed below. Once I calculated all of the molecular ratios for all of the ICD-9s, I created a combined table in Excel. In conclusion, we can say that patients with the ICD-9 code of CHF are 5.52 times more likely to experience a longer hospital stay than patients without an ICD-9 code CHF. Thank you for viewing my presentation.